Hi, welcome to this week's With Liberty and Justice for Some. I'm Congressman Mark Pocan. For our one question today with us is Dylan Hetler-Gaudet, who is working with POGO, an organization that is helping to, I think, find government waste and having accountability, ethical standards, and all kinds of good stuff in the federal government. He is their lobbyist, and we're glad to have you with us today, Dylan.
Thank you for having me, Congressman.
So my question for you is, if you had the ability to change any one federal law, you don't have to go through Congress, you don't have to go through appropriations, you don't have to go through any committee, just you can make this change. What would that one change be, and why would you do it?
Oh,
you got the power. You can do anything.
Yeah. Give me a magic wand, right?
Yes.
Okay, I hope you don't mind me doing this. It's a classic POGO thing to do, but I'm going to do like a kind of a law that does two things on the same issue.
That's okay.
It's a law that it would prohibit any member of Congress from either owning stock in or any kind of financial investment in, or receiving campaign contributions from, an industry or company that they are directly involved in overseeing because of the committees that they are assigned to. So this wouldn't be a panacea to solve all of the possible problems around ethics and corruption or conflicts of interest in Congress, but it would make people think long and hard about, the kinds of investment they have and the kind of relationship they have in terms of campaign donors, if they want to be on a committee, some kind of a committee that they care about. So I think that's what I would do, because I'm a big Article 1 guy. POGO loves Congress, and we think Congress is the most important institution in the entire government. It needs to be stronger and more effective. And one aspect of that work is to make it a bit more ethical and a bit more transparent, and to really to really enhance the trust and to try to bridge the trust gap between Congress and the public. And I think that kind of a law would go a long way toward that.
And restoring public confidence would help Congress have even more ability to have that Article 1 power they deserve.
That's right.
Yeah. Appreciate it, Dylan. Thanks so much for being with us today.
Thank you, Congressman.
The biggest fight of the big ugly law and the government shutdown fight has been around healthcare. Everyone needs it, but healthcare often is too costly for many, making people either risk the very care they need or their life savings if they don't have it. We're the only industrialized nation not to have universal health care, the only one. And the Affordable Care Act, or the ACA, was a big boost towards getting millions more people covered to meet that immense need. Before I got to Congress, it was created, and the idea was to help increase access by lowering the cost of healthcare for tens of millions of Americans. It also did things like make sure you can't get bankrupt because you're sick, or ensuring that adult children could stay on their parents' policies until they were 26. But despite the public support for this law, Republicans have had a bullseye on this plan, also known as Obamacare, for years. I remember when former speakers Paul Ryan and John Boehner made us go vote after vote after vote to try to repeal but not replace the Affordable Care Act, even years after the Supreme Court ruled it constitutional. And we all remember that single important vote cast by former Senator John McCain to keep it alive back in 2017 during the Trump administration. But now the second Trump administration has found new ways to try to kill the ACA. First, they did a number of changes to diminish its effectiveness in the big ugly law, or the reconciliation bill from this year. And now they're fighting us in trying to extend the tax credits that make the ACA affordable. Front and center in this fight has been an organization called Protect Our Care. They fight to expand access to affordable, high-quality health insurance, lower the cost of healthcare, and reduce care inequalities. I know that they are an active organization in my home state of Wisconsin, and I really appreciate all the advocacy that they do in our state. Their national president is Brad Woodhouse, a former senior strategist with the Obama campaign and former communications director for the Democratic National Committee, as well as active with many other organizations in his career. And we are very glad to welcome Brad Newhouse to this podcast today. Welcome, Brad.
Great. Thank you, Congressman. I really appreciate you having me.
Yeah, well, thank you. And, this couldn't be a more timely podcast, right? Given what we're doing. So first of all, let our listeners know in your words about what Protect Our Care is and the work you do.
Well, look, we were founded in 2016 after the
Mhm.
election results that came in, and of course, Donald Trump beating Hillary Clinton. And the idea then was just to prevent or stave off for as long as we could the repeal of the Affordable Care Act.
Mhm.
And look, and people said, "No way!" They got the House, they got the Senate. They got the White House. They'll use reconciliation. There's no way you can preserve it. But we did. And as you mentioned, John McCain, along with Susan Collins and Lisa Murkowski, but he cast the deciding vote,
Yeah.
obviously, that defeated repeal and preserved the Affordable Care Act. And then we just, we said, well, our mission's not done. I mean, they're continuing
Mhm.
to all throughout Trump's first term, and of course in his second term, they have been on a campaign of sabotage, where they have, they've tubed open enrollment. They stopped
Yeah.
funding. They didn't prioritize open enrollment during COVID. I mean, we were saying, extend it. Let's have it go longer. Let's have it start earlier so people can
Yeah.
get covered during the pandemic. And they didn't like that idea, and they wouldn't adopt that. And then they came back in this administration, and they came after the Affordable Care Act, partly because of ideology, partly because Trump hates Barack Obama.
Yeah.
He's always wanted to overturn the Affordable Care Act for no other reason. Well, for many reasons, but among them, his hatred and revenge that he wanted to strike out at Obama. But a lot of what they've done in healthcare, including the big ugly law, in the Medicaid cuts, the
Mhm.
targeting of the Affordable Care Act. It's just so they can create a piggy bank to give tax breaks to billionaires. So we have been at the forefront of fighting that this year. Of course, if you rewind a little bit to when we had control in the first couple of years of the Biden administration, we really made a
Yeah.
lot of progress. And I think Joe Biden will be remembered one day for what he did for American healthcare during those first 2 years of his term, negotiating with drug companies to lower prices for prescription drugs for people who are on Medicare, expanding the Affordable Care Act, enhanced premium tax credits among those things. And when he left, and this, we had the lowest uninsured rate
Yeah.
this country has ever had. And why should that not be a bigger goal than
Right.
breaks for billionaires?
Well, this administration, I think we have the answer on that, right? We know Donald Trump goes to work every day to first empower Donald Trump and financially, and then for anyone who could afford to belong to Mar-a-Lago, right? Those are always on the list. But given that, this shutdown fight that is starting to impact people back in places like Wisconsin more, I think it's really important that as a strong advocate for the Affordable Care Act as you are, describe what are some of the things I think people just forget from, when it was created, because again, it was before I was in Congress. What are some of the things that the ACA did and does, more importantly, for people?
Well, look, I think the thing that it does for the most Americans is it prevents insurance companies from discriminating based on pre-existing conditions, and that is
Yeah.
the one thing that more Americans benefit from
Hmm.
than anything else, as you know. And this was something that we used in advocating for passage of the Affordable Care Act. Before it, being a woman was a pre-existing condition.
Yeah.
Having had a pregnancy, being pregnant, having any prenatal complications would be a pre-existing condition where they could deny you coverage or charge you more. But that also applied to if you were a child that contracted diabetes and then you go
Hmm.
get insurance on your own later in life. That's a pre-existing condition, and so that is so important. And really, that was the issue. One of the big issues that we prosecuted in 2018 that resulted in Democrats taking back over the House was trying to protect that. But then it's making insurance more affordable and
Hmm.
accessible to millions of people. Part of it is, Congressman, is making sure that we are actively trying to get people covered. So, the too many people don't get covered. They think it's too expensive. They think they don't need it because they're younger or healthier and haven't had many problems. But part of it is and this was what the Biden administration did so well. It's what the Obama administration did so well. Going out and evangelizing about how important having coverage is, and
Mhm.
not allowing yourself to fall into a catastrophic illness that results in extraordinary medical debt or bankruptcy. So prioritizing open enrollment, but then throughout this whole thing, the one thing that has been unfortunate is we haven't been able to do enough to lower costs within the healthcare system
Sure.
writ large. So that's why in these enhanced premium tax credits were so important to help more people access low cost coverage. And because of Republicans, that's going away, and millions of people are going to lose coverage, and millions of people are going to pay more, and that means they're going to have less for other things like food.
Yeah. Is one of the Republicans have moved their argument over the last month quite a bit on what the shutdown's about. But one of the places they stopped at, and I got asked by a reporter, was, well, yeah, but aren't these, special enhanced tax credits because of COVID? And, like any law we do, we keep continually improve it. And if we found some people were not getting access to the goal of the Affordable Care Act, which is give more people coverage, that's what we did, right? We adjusted it for people's incomes and people's needs to make sure more people could have health insurance. And, that's normal. That's the legislative process that we do every single day.
That's exactly right. And I mean, if the net result of what we learned was that making these investments in lowering people's premiums and providing them a tax credit, and we have a
Mhm.
lot of tax policy that incentivizes things in this country. I mean, we have
Right.
tax policy that incentivizes purchasing homes, and then of course there are all types of tax policies that the rich get to
Yeah.
take advantage of. And so, why not have a tax policy and a healthcare policy that allows more people to get covered? Because remember what happens if people don't have coverage, we still have to pay for their care.
Yeah.
We have to pay for their care when they show up in an emergency room. We have to pay for their care when they show up at a hospital and they get sick. That burden falls somewhere. And so the experience is that just by making this additional investment through the tax code to get people more coverage, and by the way, more people covered, a healthier society
Yeah.
benefits the economy.
That's good. Yes.
It's the economy. There's nothing. There's nothing good for the economy if people don't have coverage and get sicker and miss work
Right.
and become a burden on society. So you just can't square that. Well, this is too expensive. It was only for COVID. We should take it away, and people should be on their own. With passing these damn tax breaks. Remember what they did in the big ugly law? They took they took tax
Mhm.
policy that was supposed to expire. So they're making this argument. Well,
Yep.
these were supposed to expire, but they took tax policy from 2017, 2018 that was supposed to expire, and they made it permanent for billionaires forever,
Yeah.
forever. But they don't want to extend these tax credits to help people get health care. That's the wrong priorities, and the American people know it, and that's why Republicans are losing on the issue of health care, and it's why they're losing on the government shutdown.
Well, I remember I wasn't around when it was created. That was before I got to Congress, but I was around while it was being implemented. And I remember being hugged at the grocery store by a daycare provider crying because she finally had health insurance because she could never afford it prior. Because, look, we know daycare isn't a way you get rich quick. It's something you do because you care about people's families and kids. And in Spring Green, Wisconsin, a small community in my district, stopping by some of the Main Street businesses, and some business owners lived above their business on the main drag there, telling me how, again, for the first time, they were able to get health insurance, right? That's the stories that we know came out of the Affordable Care Act. But rather than the outright killing of it, because they haven't been able to do that, now they're just poisoning it, right? And some of that poisoning happened in the big ugly law. Can you talk about some of that those changes that they made that negatively affect people, and that's what the fight's about?
Well, look, I think every change they make, every approach that they take is to restrict coverage for people. But I think in this conversation, Congressman, we can't
Yeah,
forget what they did. We can't forget what they did to Medicaid, and I think that that
I was going
that
to come around to that in a little
yeah,
bit.
yeah. So they're just making it harder for people to access coverage. And one of those one of those marries the Medicaid changes with the ACA, because what
Yeah.
they've done is they've adopted work requirements for people who are getting the Affordable Care Act through Medicaid expansion, or getting Medicaid through the Medicaid expansion that was provided through through the Affordable Care Act. And as you know, work requirements are just bullshit. Excuse my
Yeah.
language, but they are meant to create paperwork requirements so that people will not access coverage. And then when those people don't get coverage, the money saved by those people not getting coverage goes to tax breaks for billionaires. Almost everybody on Medicaid either works or cares for someone in their home, or they are home because they are sick, or because they're in a nursing home. I mean, these work requirements and the Medicaid expansion population who got
Mhm.
Medicaid through the ACA Medicaid expansion was a problem in search of a solution, or a solution in search of a problem. But it was meant for one thing: is they wanted to create confusion, and we know this from Arkansas, from Georgia. It
Yeah.
created so much confusion. People lost coverage not because they weren't working, or not because they weren't productive citizens, but because the barrier to the paperwork was so high, or because of lack of knowledge. Because it's not like the Republicans, when they put these in place, that they'll go out and sell it to people like, you got to do
Right.
this or you can't get coverage. 'Cause They,
Yeah.
they, they, they want people to fall off coverage because they want to use that money for other things.
Yeah, Arkansas, I think on the SNAP program, when they implemented some of this prior to what they just did in the big ugly law nationally, I think 70% of the people that got kicked off of the program were eligible. They just couldn't
Right.
meet the requirements of the paperwork and everything else in order to get benefits that they should have been able to get because they actually qualified.
Exactly right. And look, that's another big issue on this shutdown, that not the purpose of this of this meeting
Yeah,
between us, but
right.
what they're doing to hungry families is just abominable.
Yeah.
And it's going to happen here in the next few days.
So on the medical side, in the big ugly law, I mean, they did the changes to Medicaid, they did the changes to the Affordable Care Act. Um, they that's about 15 million people, I think, are going to lose
Yep,
health insurance
exactly
because of
right.
that. But what I think often gets missed is it triggered a automatic cut of $500 billion to Medicare. What does that mean? It's not been talked about a lot.
Well, look, I think one thing it means is that's a big campaign promise broken
Yeah.
by President Trump, and I'm assuming by Republicans. He promised the American people he would not cut Social Security, and they have cut
Hmm.
Social Security. They've cut it because they're making it impossible for people to get through and find
Hmm.
out about their eligibility and their checks because of all the cuts to the Social Security Administration. But he promised not to cut Medicare, and they cut it. They triggered this cut to Medicare, and Medicare really, I mean, Medicare is among the best insurance plans in the entire world. I mean,
Yeah.
this is why we need more. We need to get closer to that type of universal coverage. So Medicare can't afford a $500 billion cut. And by the way, it is something in on the political side that we need to be talking about more, because there doesn't seem to be any willingness or urgency among Republicans to fix that cut. Here's the other thing: they are going, and Trump, Trump every day says something. It's crazy stuff. We're going to reduce prescription drug costs by 1,500%. Well, there's no mathematical. I mean,
Yeah.
that's just crazy. And
Right. Right.
why people aren't questioning his cognitive ability when he says stuff like that, I don't understand. But they're going to undermine, and they did, this orphan drugs law that was in the big ugly bill that
Mhm.
undermines the negotiation law that President Biden signed and the Democrats passed. So this is what the big ugly law is doing. It is stripping healthcare away from 15 million people. That's 10 million Medicaid. That's
Mhm.
5 million the Affordable Care Act, because they're getting rid of these tax credits. And then they are going to raise your prescription drug costs if you're on Medicare, and they're going to raise premiums on 20 million Americans who are not going to access these tax credits under the under the Affordable Care Act. So they're ripping away your coverage, they're raising your cost for coverage, and they're raising your cost for prescription drugs. And then Mike Johnson has the audacity to say we're the Republicans, we're the
Mhm.
ones reforming healthcare.
Yeah.
Congress people will say anything.
Right. True. Well, that actually points exactly to one other thing that their law does, which is um, it creates about $434 billion in uncompensated care. That means you still get sick, right? If you don't have tax credits, if you have any of these other changes that have affected your family, but if you go to the emergency room and you get care, someone has to pay for it. So because of it, insurance companies for everyone are adjusting rates to make up for it. I had a business in my district told me this month they got their rate increase for next year, 41% increase for their group insurance plan
Oh my God.
because of this. And you remember the House had nothing to make up this difference for hospitals, especially rural hospitals in places like Wisconsin. In Eau Claire, Wisconsin, in Wisconsin's third congressional district, represented by Derek Van Orden, they've lost their two hospitals. They have no hospitals in a community of 73,000, and it was a
How
center.
does he explain that to his constituents?
Well, and that's the thing. He doesn't know how to. He keeps saying that if by shutting down the government, we're risking $50 billion to rural hospitals, and I have to go back and say, no, you created a gaping wound of $434 billion of uncompensated care. You in the House did nothing. The Senate Republicans added a $50 billion Band-Aid, but that's one out of every $9. That's why we all are seeing increases in our insurance right now because of this, right?
Well, yeah, that's exactly right. I mean, this effect cascades. I mean, so it's not just the 20 million people who will see who see their rates increase, their premiums increase under the Affordable Care Act because those premium
Mhm.
tax credits are going away. It is the rate increases that because of the uncompensated care that insurance companies have to endure. But then it is this just devastation of rural hospitals, community health centers,
Yeah.
Planned Parenthood clinics. We have what we call the Hospital Crisis Watch, which is we're tracking hospitals or care facilities. So it could be a hospital, it could be part of a hospital, be a nursing home, it could be a Planned
Mhm.
Parenthood clinic or a community health center that have either closed or drawing back operations are at threat of closing. And just recently, we hit the 500 mark.
Mm.
When it started, there was a study where we aggregated about 300 hospitals.
Yeah.
Since this passed, that's risen by 200. Those are
Wow.
either so some of them are eliminating maternity wards. Of course, the
Mhm.
first thing you're going to do is
Right.
make it harder for women to access health care again, just
Yeah.
like the old days. So they eliminated maternity ward, and if that didn't enough, it might be that they eliminate the emergency room, or they close the facility altogether. I mean, I'm from North Carolina, and very shortly after the law was passed, there was a hospital in a rural area of North Carolina that had closed,
Mhm.
but because the Democratic governor at the time, Roy Cooper, and Republicans in the legislature passed Medicaid expansion, it was reopening. It
Well,
saw a
yeah.
path to profitability. It saw a path, actually, not even profitability. It saw a path to service. They wanted to serve their community. And as soon as this law passed, they scrapped those plans. And there's example after example after example, and it's in every state, and I think probably virtually in every congressional district. And so I don't know how people like Van Orden, who, by the way, I
Yeah.
appreciate you going to his district and talking to his constituents when he's not willing to.
Yeah. Yeah.
That is a tactic that every
Mhm.
single member of your caucus should do. You've done it. Rokana's done it. A few others, but we need every member of the caucus to go to those adjacent Republican districts, because they're not holding town halls, and when they do, they're screening, and they're only allowing voices in that support them, and explain to their constituents that that hospital didn't close for any
Yeah.
other reason than they cut $1 trillion out of Medicaid, and then they provided a $50 billion Band-Aid for a bullet wound.
Yeah. No, I did 7 town halls in 10 days this month because I had a little extra time on my hands in Derek Van Orden's district. And, this affects me personally. I grew up in a lower middle class family. My mom was on Medicaid in her final years in the county nursing home. Wouldn't have been able to do all that if this had gone away. And we know this could take 1 out of 4 nursing homes And in rural parts of the state, like in Sauk County, that I have most of it, but Derek Van Orden has a part of it, they have one nursing home in the entire county. And it's a county home that just sold to a private entity. And now there's at risk of losing the only home they had in an entire county that has a lot of tourism and a lot of folks that live up there. So, yeah, there's no question the multitude of effects. And that's why I wanted to talk about those, are there. And, simply hiding in your basement, drinking pina coladas and tweeting is not what a member of Congress is supposed to do. And that's what a lot of these Republicans have been doing.
Yeah, and Congressman, it's just a head scratcher.
Yeah.
It really is. I mean, I understand that we're in this tribal situation in our politics, and if a Democrat proposes it, a Republican has to oppose it, and
Hmm.
and vice versa. But let's just look at where the voters are. For example, the Medicare drug negotiation law that you all passed and that
Hmm.
President Biden signed and implemented. I mean, 90% of the public supports it. 90%.
Yeah.
90%. I mean, and that's not 100% of Democrats and 5% of Republicans and the rest independents. It's 90 across the board. I mean,
Hmm.
everybody supports Medicare having the tools to negotiate for lower drug prices. And look, Donald Trump gets this a little bit rhetorically because he sees he
Yeah.
understands, like he's not into things being unfair and for his constituents, and when he sees that other countries are paying 4 times less than
Right.
we are for the same drug, he comes out and he'll say stuff but didn't do anything.
Right.
And the Republicans in Congress, your colleagues, really have no interest in in doing anything. And if anything, they're unwinding those laws, and the big ugly law is unwinding that law. And it's just crazy to me. It's like why you have something that has support in every congressional district in this country. And the same is true with these premium tax credits. I mean,
Hmm.
there are more Democrats that support them than Republicans, but a majority of Republicans support the extension of these premium tax credits. And then Republicans act like there's no support for it. And it's so antithetical, I think, to
Yeah.
their own political interest. But they have muscle reflex against people getting good health care in this country for some reason, if the government has to be involved in it.
Yeah. No, if I was a Republican, I would probably hide in my basement, drink pina coladas, and tweet also. Right now, I think that's the safe
It's
space.
indefensible. It's
Yeah.
indefensible.
Yeah.
Yeah.
So that's what the fight's about. And, right now, as you said, it's open enrollment. So it's important for people to know that so they can get onto the Affordable Care Plan. But we got to figure this out. This is our fight. And hopefully, people who are on the plan are going to see these increases and talk about it, right? Put it on their social media. Contact the press. Let them know what your plan just increased. Because honestly, those stories are going to be way better than anything you or I can do.
Yeah, I gotta tell you, Congressman, this is a really hard time for those of us that are in this type of advocacy, because
Mhm.
November 1st usually comes every year, and we're just out there telling people that they need to sign up, they need to have coverage, and they need to know through the whole all the Biden years. We would tell them, there are a lot of $0 plans, they're low cost plans. We want people to have coverage, and even today, tomorrow or at midnight tonight, open
Yeah.
enrollment will start. We still want people to get covered, but they need to know why their premiums are going up, and if
Yeah.
they can't afford it, if they can't afford to sign up, if they feel like they can't sacrifice food or a mortgage payment or rent to get covered, they need to say, and they need to tell their members and Congress, and they need to say on their social media feeds and around their water coolers that this is going up because of Republicans, because
Yeah.
Republicans decided to end these tax cuts. It's really heart wrenching because normally what we do is we're not a navigator protect our care, but we
Mhm.
we we go around. Joe Zapecki and our team,
Yes.
they've been all
Yeah.
over Wisconsin telling people, you got low dollar plans, you got $0 plans, sign up. This is important to you. It's important to your family. It's important to your small business. And we can't quite say that the same way right now, because we have to tell people
Yeah.
it's important. Go look, find a plan that you can afford, but know that according to Kaiser,
Yeah.
114% increase. Now, 114% 20% increase, to those of us that don't do
Yeah.
math well, that's double.
Yeah.
That's more than double.
Yeah.
And people need to know why that is happening. And so that's part of that is part of what we are doing. One thing that was noticed in an article today is that we're putting about 6 figures behind Google search terms, which when
Good.
people go in this week and that, why are my premiums going up for 2026? They're going to get an ad that says because of Republicans.
Good.
And it's not us saying it. It's Kaiser Family Foundation. It's the Center on Budget and Policy Priorities. It's other people saying it, but the American people are going to know because they're going to Google it and they're going to find out.
Yeah. No, and I'll just wrap this part up with just saying, I only members of Congress, I think the only people in the country mandated to be on the Affordable Care Act, right? So 8 years ago, actually just about exactly 8 years ago, I had a triple bypass, open heart surgery. And because it was around this time of the year, the surgery was this time of the year, physical therapy went into January. My total cost for over $200,000 worth of care was about $7,000 out of pocket because it was partially, for this year and partially in the next year. But I'm doing really well because of
Well,
it.
you look
And
great.
yeah, I
You
can
look
lose a
great.
few pounds. I can lose a few pounds, but
Who
it's
can't, right?
yeah,
Who among us?
it works, right? And it's been for 20 million, 22 million people to have healthcare who didn't have it.
Yeah.
That's what the intention of the law was. Let me just ask one last question. The future of what we need to do around healthcare. What else do we need to be looking at to do to make healthcare more accessible, more affordable for the American people?
Well, I mean, look, we need to put people in charge who will do it. I mean,
Yeah.
that
Yeah.
is the and look, we have really important elections coming up. We have important elections coming up next week in a couple
Yes.
states. We have a really important election next year, and then after that. And I think we've got to put people in charge who will prioritize healthcare. This is not necessarily protect our care position, but I would just tell you, I think where we tried to go in the Affordable Care Act, and for whatever reason, during those negotiations in 2009 and 2010, where we were kind of trying to shrink the period of time that people would need access to the Affordable Care Act.
Mm-hmm.
So we did that on the low end by having kids on their policies up till 26, and there was proposal to lower the eligibility age for Medicare to 60
Mm-hmm.
or to 50, or to 55. And, I think trying to, we know Medicare works. Now we can, I think we all know that there are problems with Medicare Advantage. And we tackle those and the greed of the, of the insurance companies. I mean, I think we'd all like to get away from the profit model here as much as we can. The less we had to depend on insurance companies and the more we could have a plan like Medicare, I think would be better for the American people. And we got to keep fighting for the 10 or so states that are recalcitrant and have refused to expand Medicaid. We need to either put the political pressure in those states to get that done, or we need to do what we were going to try to do during the Biden administration. It was proposed, but we didn't get it done, which was to force a federal solution on those states to give that population access to what they would get had their states expanded Medicaid. So, we need to get more people on Medicaid, more people access to Medicare. I think if we lowered that age of eligibility, and then the Affordable Care Act would be for that middle period.
Yeah. No, I think the difference is we've got lots of plans to expand healthcare, and they've had 15 years to come up with anything other than a concept of a plan, right? And we still,
plan.
yeah, right.
Famous phrase, right?
Everyone remembers that. That was long enough ago, over a year ago, and they still haven't brought this even concept of a plan. So, well, Brad, thank you so much for being with us. How do people follow Protect Our Care, or you give us your socials so people can follow?
Well, I'm on X at Woodhouse Woodhouse B, and I need to get on these other other platforms. I guess I still call it Twitter. But protectourcare.org. I mean, and we just have And then you can follow Protect Our Care on every social media platform. But protectourcare.org, and we've got just about every fact sheet, every piece of information, that, message guidance, everything you would ever need to know to go out and advocate for for better American healthcare.
How many states like Wisconsin do you guys also have a physical presence?
We're in about 14 states right now. It's
Okay.
it's somewhat elastic. It's based a lot on what's going on legislatively, like where
Yeah.
we try to we try to be in states where we can support our champions like you and like Gwen and like Tammy, and then we're in states where we can put screws to Republicans to try to get them to do the right thing. For example, we're really over indexed in California, New York, Pennsylvania, Arizona, places where we have multiple numbers of vulnerable or swing Republican House members. And, we're not, for the first 18 months of this, we're not thinking so much about the election. We're thinking about trying to get them to do the right thing. And we spent $10 million trying to get about a dozen of them to do the right thing on the big ugly law. And I think that one guy in Pennsylvania cast a decent vote.
Yeah. Well, appreciate all the work that Protect Our Care does, and especially in a state like Wisconsin. A lot of events, a lot of things to help people get access to healthcare. I mean, that's what we're doing events about, right? Is how people can access healthcare.
Absolutely, and that's really the most important thing, is that people get access to healthcare. The unfortunate thing is that that it has to be a political fight. I mean, it really shouldn't be, but it is, and that seems to be the way Republicans want it. So we got to meet them.
Yeah. Well, I think they're showing themselves for who they are right now. And thanks so much, Brad, for being with us. We really appreciate it on the program today.
Thank you, Congressman.